Hello, I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So, Dr. Brown, today we're going to do some fact checking. Some of the statements that have been made by these so-called healthcare leaders of the nation right now, the magical world of Dr. Oz and, of course, RFK Jr., warning about, different things, but we're going to fact check. And stay tuned till the end to hear about something that is on the horizon that every American should know about. Let's roll first clip.
But many families, as Senator Britt alluded, do not have the ability to have children. But it turns out that it's about 1 in 3 families, a much higher number, that don't have the number of babies they desire. They're under-babied. So this president committed to address that during the campaign, and he is delivering on that today in a way I don't think anyone thought was possible.
All right. Hi, everyone. So this is real.
Under-babied.
This is real, under-babied. So the government is shut down. Roughly 750,000 federal employees are furloughed each day. People aren't getting paid. Food bank lines are growing. Flights are delayed because air traffic control is stretched thin. And while families brace for impact, the current administration, guided by Project 2025, is quietly gutting social programs that they deem as democratic programs. So this isn't just a budget fight, it's a fight for the soul of the country. Now, the background of all of this, somehow, amid all of this, Dr. Mehmet Oz holds a press conference about fertility. He said, quote, people are eager to have kids and cannot, end quote, claiming that 1/3 of families are, quote unquote, under-babied. So, fact check, the phrase under-babied is not a real phrase. It's not a real phrase used in population studies. Researchers have called it unrealized fertility, ending up with fewer children than desired. So the UN Population Fund puts that number closer to 1 in 5, not 1 in 3. So in the US, people still say the ideal family is about 2 to 3 kids, but actual fertility is lower due to delayed childbearing, cost of living, and limited access to care. So some surveys do show higher figures, but many respondents are still in the childbearing years. So those numbers can overstate the gap. The bottom line is that the best high quality evidence, because we follow evidence-based medicine and information here, supports that about 1 in 5, not 1 in 3, are quote unquote under-babied. And even calling America under-babied by 1/3 is greatly exaggerated. So, here at home, the best data shows that we are not under-babied. People aren't having kids. Why aren't they having kids? Because there's crushing student debt, unaffordable childcare, rent that rivals a mortgage. And that's not fertility or infertility. That's survival math. So this concept of under-babied is just ridiculous. It's ideological. It implies that worth equals reproduction, erasing single people, LGBTQ plus families, and women who choose otherwise. If Dr. Oz really cared about families, he'd talk about paid leave, affordable housing, maternal health, and reproductive freedom, all being dismantled under this same administration, and even worse during this shutdown. But instead, he's moralizing while real families face real shutdown fallout. So Dr. Oz, people aren't under-babied. They're under-supported, they're underpaid, overworked, and the problem isn't that Americans don't want children. It's that America makes it nearly impossible to raise children with dignity. And so that's the truth that we're not shutting down. And then, of course, right on cue, RFK Jr. decides to double down on these misinformation Olympics. Roll the clip.
Today, the average teenager in this country has 50% of the sperm count, 50% of the testosterone as a 65-year-old man. Our girls are hitting puberty 6 years earlier. And that's bad, but also our parents aren't having children. Parents who want to have children do not have access. I have 7 children. I feel that God has blessed me with that, and I can't imagine how different my life would be if I did not have that blessing.
And then came Robert F. Kennedy Jr., doubling down on the familiar formula that fear is dressed as science, because apparently America is no longer safe or healthy again. So here's the claim. Today's teenagers have half of the sperm count, half of the testosterone of a 65-year-old man, and apparently little girls are hitting puberty at age 6. 6, as in a kindergartner, as in still believes in the tooth fairy, you guys, age 6. So before we can start the panic, ordering your water filters and hormone panels, let's pause and let's check the reality check and fact check here, what the science actually has said, not the sound bites. So yeah, the sperm count in adult men have declined roughly 50 to 60% since 1970. And there are articles that show that. But those studies are in grown men, not teenagers. They reflect lifestyle, obesity, exposure to environmental dangers, and some simple fact that our health habits aren't what they used to be. But Kennedy's claim that teenagers have a sperm count that is that of a retiree is not science. That's fiction, you guys, and not even the good kind of fiction. And then he goes on to say girls are hitting puberty at age 6. We're talking months, not decades. This trend is not trending back to that young. The average age right now is for the first period for a girl between 12 and a half has only dropped to 11.9. And some girls, particularly those that may have obesity or certain environmental factors, can start breast development early, but not puberty at 6. That is like not the norm. That is like, a red herring. And we even call that in the medical community precocious puberty, and it's very rare. And the science shows gradual biological shifts, not national hormonal meltdown. So this is evolution, if you will. So now RFK Jr. is so busy rewriting endocrinology because he's not a doctor, right? He's not a doctor. But Dr. Oz took the podium to warn that Americans, again, remember, are under-babied. So somehow these two things together in the middle of all of the shutdown, according to him, 1 in 3 families, and now this, half of the sperm count, begs to question what's really going on. What are they really focusing on? So the term and demographics of unrealized fertility, all these things that are, again, clouding what is really going on in America right now is probably the snapshot of United Nations Population Fund 2025 report. So again, why do we have to go through all of this? Why are we worried about these things? Because they're throwing this information out to us, making us worry about it, but it's not factual and it's taking our eye off of what's really going on in America. So stay woke, as they don't want you to. Right, Dr. Brown?
Absolutely. Absolutely. And, of course, meanwhile, while all of this misinformation is going on, Japan is now sounding the alarm. Japan has officially declared a nationwide influenza epidemic with more than 4,000 hospitalizations and over 100 schools shut down in a span of days. And what makes this outbreak worse, it has hit 5 weeks earlier than typical flu seasons, and experts warn the virus may be mutating more rapidly. And so here's why this matters in the United States. If a highly contagious or mutating strain can take hold in a country as well prepared as Japan, imagine what happens here when we've gutted our public health infrastructure, the government is closed, there are fewer epidemiologists, there are fewer lab scientists, there are fewer people tracking, tracing, testing. And of course, fewer people are getting the flu vaccine. And in the background, we have fewer inspectors checking our food, fewer regulators ensuring medication safety, and stalled scientific discovery. So this isn't about low sperm count or precocious puberty or whether we as Americans need more babies. This is about whether our country is healthy and prepared. Because pushing for more births in the middle of rising maternal and infant mortality rates isn't a policy, it's reckless. And those mortality rates are rising as we have rescinded women's reproductive rights and the overturning of Roe v. Wade. So the question isn't how many children we have, it's whether we'll have the systems with the government open or closed and the science and the will to keep the children and all of us alive and well.
That's right. So don't get lost, you guys, in the misinformation. Fact check. double down. Even if you're into Chat GPT, question its validity and really make sure that you're looking at things that are evidence-based of what we do as scientists. So we want to get loud about prevention, get active about policy, support the science, and fund public health, because the question isn't how many children we have, it's whether or not we can have the courage to build a country that can keep them safe and healthy. So stay informed, stay vigilant, and remember, the truth is the most powerful tool we have right now, you guys. So thanks for watching. We are Aya, contributors of MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.